Hello, my name is Laura Ballard. I have been asked to talk to first year nursing students about their up and coming choice in their nursing career. I am currently an associate's degree um, nurse. I've been in the nursing field for over 25 years, and I am taking bachelor's classes and master's nursing classes right now. And I just want to welcome you to your amazing journey that will last you the rest of your life. I've been asked to talk to you today about your up and coming career in nursing. Whether you got into it by accident like I did, or you've dreamt about it your whole life, you are in for the ride of your life. There will be very exciting times that fire your desire to learn more. Other times will be devastating, and you will possibly cry with a patient or their family who has had a loss. Nursing has become more specialized than ever. Just like physicians have divided up into specialty areas more than ever. It used to be the norm for a doctor to set bones, do surgery, deliver babies, and run an office. They did it all. But now they are specialists, oncologists or internists or geriatrics or GYN docs. It's very similar in nursing. There was a time early on in my career when I felt very inadequate. I felt like I didn't know very much. I felt like I didn't know it all. In other words, I didn't know how to be an OB nurse and an ER nurse and an ICU nurse and an oncology nurse. I've done many different things over the years, starting as a nursery nurse and a postpartum nurse. I did that for 10 years. And most recently, I have been the last 2 years working in hospice, which is an amazing opportunity to be able to walk with families through a very difficult time, ease their minds, and do lots of teaching and loving. Many have been so grateful to have a prayer or an encouragement from the Bible. Some take comfort just in knowing that I am also a believer. And it has taken about a full year to a year and a half for me to just begin like I feel like I have a handle on this job. As I look back on the things I've learned and taught and realized, I've realized that I've benefited from knowing statistics and theory studies. I've used it in my current work, and I've used it many times in teaching and supporting our philosophy in hospice and other areas that I work when we care for our patients. It really is beneficial to have the work of our predecessors to help us understand and teach others things that are so important. For example, sometimes families want to know, why aren't we doing IVs? Why aren't we doing feeding tubes? Why aren't we doing things to make them better, make our patients better? And we've come to know through studies and statistics and teachings that this is really kind of cruel. Our bodies aren't designed to be able to process fluids and foods when our organs are beginning to shut down as we get closer to the end of life. Families often feel like their loved ones are being starved, so it's really important to be able to explain to them how we've come to learn that giving IVs and artificial feedings really cause more harm and discomfort than they do to give the patient any kind of comfort at all. Hospice also requires a whole team to be involved. We have chaplains and social workers and case managers, and we have CNAs, and really requires the whole team to come together to really meet the physical, spiritual, and social needs that the families need um, during these times when at end of life. Um, Patients often realize when they're dying that they have either had an amazing family life that's beautiful and they all come together, um, which is always amazing to be involved in that kind of thing. But then there's also families that have had a lifetime of not such great relationships, and they have to come to terms with how do they mend those relationships. Are they going to be able to mend those relationships? Are they going to be prepared to leave this um, world and go on to the next? And what does that next world look like? There are so many questions about end of life and spiritual matters. So it really is a great opportunity in hospice, at least in this particular part of life, to be available to use your faith as a ministry, to try to meet those needs spiritually, to help them find what their beliefs are. There really is a fine line when it comes to ministry to really be careful about not crossing lines, about not pushing your own beliefs on somebody, but trying to help people find what that is for the reality in their own life. As it is in any setting, my desire to minister to others isn't always wanted or maybe even needed. There has to be wisdom and discernment for the right time to minister to patients and their families. So I want to encourage you, let me be of some help right off the bat. You will never know it all. You will choose a specialty. Hopefully you'll spend at least a year in that area learning that specialty and getting to know the intricacies of that area. And then if it doesn't fit you, you have the opportunity to go on to the next specialty and see if it's something that you enjoy or something that'll fit your life better. But you'll come to realize that you really will become specialized in knowing that area of nursing or that area of caring for others. That's the joy of nursing. There are opportunities everywhere. If you love numbers and statistics, or if you love lab work and research, there's areas for all of that in nursing as well. I've recently been in need of a change in my career. I put my resume out on the website that posts jobs available according to the specifics of my experience. I had 91 opportunities sent to me in one day. There were that many nursing jobs available, most of them in my area, some of them around the country. Travel nursing, wow, I really want to try to do travel nursing. What a great opportunity to go use your career and your knowledge and travel around and use it in other areas. That was a crazy experience, going through 91 opportunities looking for just the right job. I did find the job that I wanted with all the things on my wish list, and that was really kind of amazing for me and fun. The things on my wish list, after working shift work and nights and evenings and weekends and being on call, those are some of the things I didn't want to do anymore, and I did find a job, was offered the job, and took the job with all of those criteria. I don't have to work weekends, I don't have to work holidays, I don't have to work evenings. I would recommend that you do all of those things because it's important to have those experiences to gain that independence. Um, and I feel like we all kind of need to work through those different things to figure out what it is we love and how we like to work. Some people love to work nights. I did for a while, and I felt like I paid my price, and I am done doing that. I don't think I can work nights anymore. And it's important to know those things about yourself and what you're capable of and what your boundaries are. Um, in preparation for this talk, I went to the web to see what information I could find out about the statistics of uh, satisfaction in the nursing field. Here are some of the statistics I found. It comes from a site called Nursing Fact Media, Media Relations. It says nursing is the nation's largest healthcare profession with more than 3.1 million registered nurses nationwide. Of all licensed RNs, 2.6 million or 84% are employed in nursing. Registered nurses comprise one of the largest segments of the U.S. workforce as a whole and are among the highest paying large occupations. Nearly 85% of RNs worked in the general medical and surgical hospitals, where RN salaries averaged $66,700 per year. RNs comprise the largest segment of professionals working in the healthcare industry. Nurses comprise the largest single component of hospital staff, are the primary providers of hospital patient care, and deliver most of the nation's long-term care. Nurses are the backbone of the health industry. That's my 2 cents worth. Over the years, healthcare has moved to sites beyond hospitals, and nurses have increased in their ranks in a wide range of other settings, including private practices, health maintenance organizations, public health agencies, primary care clinics, home health care, nursing homes, outpatient clinics, surgery centers, nursing school operated nursing centers, insurance and managed care companies, schools, mental health, hospices, military. It just goes on and on. There are so many opportunities and areas for nursing to get their foot in the door and have different experiences. It seems mind-boggling to me, but at the same time it's very reassuring to me. This is job security. With more than 4 times as many RNs in the United States as physicians, nursing delivers an extended array of healthcare services, including primary and preventative care, by advanced nurse practitioners in such areas as pediatrics, family health, women's health, and gerontological care. I mean, the lists just go on and on and on here. All the areas where nursing can grow, nurse anesthetists, nurse practitioners. I mean, you can go on and on with your education, and there's so many ways, depending on whether you want to work in patient care, work in teaching, work in research. It's just crazy how much of it there is available. It looks like, according to the research, the nursing shortage is getting more and more because the areas of nursing are expanding so much. Nursing shortage will grow to more than 260,000 registered nurses, even as healthcare continues to shift beyond the hospitals to more community-based primary care and other outpatient sites. This is expected to kind of this projection is for the year 2020. That's only 3 years away. So let me finish by saying um, congratulations for choosing nursing. It's an exciting journey. You're going to love so much of it. It's hard. Um, there's lots of long, hard nights, getting up really early, staying up really late, depending on your job. Um, Lots of things will change your life and change your thought process and change how you look at others and feel about the things that you do and say every day. Um, it's just benefited and affected every area of my life. So I encourage you in your journey to stick with it, keep learning, be excited about your opportunities, take advantage, especially in nursing school, um, take advantage of those people, un, be the umbrella that's over you so that you can have as many opportunities as you can in that journey. Enjoy it. Um, you are the next generation, and statistically, going to be a very successful and a very valuable part of the future of this industry. Thank you for listening. Good night.